Thank you so much for joining, first of all. This is our 12th episode of Let's Talk Public Health. It's a platform we started sometime last year. And this is where we kind of bring people together, actually, experts in the field, mostly from Pakistan. All our episodes have been currently from experts based in Pakistan, where we're talking about different public health issues which are very pertinent to the landscape in Pakistan. So we've had discussions on family planning. We've had discussions on NCDs. We've had a lot of other discussions on IHRs as well. And we're very excited that today you're joining us to have this discussion on the global health security agenda and IPC, infection prevention and control. Just for everybody else who's in the audience today, I just did want to introduce you as well. So Dr. Subhan is a public health specialist and he has experience in the global health security agenda, disease surveillance and response, as well as infection control. And he's currently working as a technical advisor in infection prevention and control to support the Ministry of National Health Services Regulation and Coordination. I'm Michelle Gyani. I am the manager for Gallup's Public Health Program. And I'm very happy that you're joining us today. So I'm going to hand it over to you. Thank you.
Thank you, Michelle. Hello, everyone. I think we will be starting it without any delay. There was some issue with the connectivity. I think the link. So because there are few guests and friends of ours from our global offices as well who are also joining this a small discussion on global health security agenda and importance of infection prevention and control. Michelle, can we go to the next slide?
Ji, sure.
So what we will be discussing today is international health regulations, global health security agenda, infection prevention and control program, and joint external evaluation. So we'll see, why all these international IHR, global health security agenda, what is the importance of these documents, and what we have to do in each and every country of ours. So we'll see in the next slide. Next slide, please. I know, I also have to keep in mind the time. 21st century has, we can call so far that it is the century of outbreaks because we have seen so many outbreaks across the globe. For instance, the monkeypox, Ebola virus, SARS, Sudan virus, Zika virus, and dengue. And in the end, last but not the least, is the mighty pandemic of COVID-19. So there are so many, outbreaks and continuous spread of infections was going on in the world, especially if in the Europe, I would say in the start of this 21st century, that pushed all the leaders across the globe that there should be some regulation that so that each and every country is safe and they are not cause of spread of infection from one country to another country. So next slide, please. So that's the point from where international health regulation came in. Next slide. Okay. So, the whole world is changed into a global village. There are multiple thousands and hundreds of thousands people traveling from one country to another country on daily basis. So just imagine if there is any infectious disease in a one person in any country, so that person can spread it to, in any country in the world. So that was the issue whenever there was the outbreak in the world. So it almost always disrupt the international trade as well as the travel component. But the whole world is so dependent on each other that it was continuously causing an issue in the world forum. So that's the point from where the need for a health regulation for the whole world emerged. And then IHR, it was signed by over 194 WHO member states, and the whole document of international health regulation 2005, if you see, it covers most of the areas that are related to the infectious diseases, from the prevention, detection, and its response, and just to make sure that each and every country has a stronger health system that is able to prevent, detect, and respond and contain the infectious threat so that it does not spread to the outside of that country. So it's actually rights and obligations for the countries just to follow this component so that if there is an infection in country, it should remain in that country. And IHR is not limited to a specific disease, but these are actually applicable to health risk irrespective of their origin, outsource. They will follow the evaluation of diseases, for instance, the factor affecting their emergence and the transmission. So this international health regulation actually provides all the documents, all the guidelines that can make sure that country and definitely it also provides that guidance to the countries to make their system prepared so that they can tackle to any health emergency. Next slide. So, scope of IHR, if we see, is to prevent, detect against, and control and provide public health response to the international spread of disease in a way that they are commensurate with and restricted to public health risk and which avoid unnecessary interference with international traffic and trade. Next slide. So that was actually, as I mentioned, that the countries should be able to diagnose and prevent and contain these infectious diseases in a way that it does not spread to the other countries. One, it does not interrupt the trade, and number three is the transport between one country to another country. So that was the whole concept of international health regulation. So okay, there is a IHR has been signed by different countries. Then how to evaluate that these countries are actually implementing these international health regulations or not? So for that component, there is joint external evaluation tool. So that joint external evaluation tool is based on all the technical areas of international health regulations. So it is completely voluntary and collaborative multi-sectoral process to assess the country's capacities to prevent, detect, and rapidly respond to the public health risk, whether occurring naturally or due to some deliberate and accidental events. So that joint external evaluation as a tool actually it provides the exact status of the country, where they lie and where they stand on in compliance to international health regulation. So once we know that, okay, for instance, Pakistan conducted joint external evaluation last year in May 2023. So after joint external evaluation, each and every area, for instance, the lab, surveillance, infection control, AMR, zoonotic diseases, border health, legal system, financing, everything is assessed in that joint external evaluation. So once it is assessed, then there is a report compiled for the country of each technical area. And definitely the main report is for the national level, and then there are reports at the state level, the provincial level, because if we see in the Pakistan, we also know that after 18th amendment, provinces are independent in their health sector. So that these reports actually provides a guidance where these countries have to go and how they will go. So because these joint external evaluation reports provides a comprehensive recommendations, what are the gaps in this country and what we know what this country has to do in lab, surveillance, infection control, zoonotic diseases, etc., etc. So that's the joint external evaluation. Next slide, please. So when we are assessing joint external evaluation, I just put two slides here. So it assesses on the five different stages. First one is a no capacity. So if that country, for instance, country A, it does not have any capacity of detecting any outbreak in a way of early warning system, because they don't have any early warning system at all. So that country will be on no capacity. So they will have to build, they will have to start from scratches. If they have a limited capacity, and they have to work on that, then they will get score 2. Then the developed capacity 3, demonstrated 4, and if it is sustainable, if the country has all those capacities in each and every technical area, and then they are able to sustain it, then it's score 5. So that's the way the whole IHR component is assessed in each country by that joint external evaluation. Next slide. So global health security agenda. So there were multiple outbreaks going on. Ebola came, and specifically in 21st century, uh, the leader in the world, they realized that although international health regulation is there, and then voluntary joint external evaluation is also there, but still there are so many countries who are there is mic on. I don't know whose mic is that. Please off that one. So if so for that component, the whole world leader came, and they developed specifically, if we can recall it from it originated from the US. So US came forward that they will be supporting the countries to build those capacities of IHR. They will be providing supports. That support will come, definitely it will be a financial one, it will be a technical one, to make sure that the whole world is safe. So just to augment and support that international health regulation, global health security agenda came. So if we see definitely in the next slide, all different technical area of global health security revolves around that IHR component. The main purpose of this global health security agenda is same as that of international health regulation. For instance, prevention, detection, and response to all infectious diseases and all those public health threats. So it is actually a global effort to strengthen the world's ability to prevent, detect, and respond to infectious diseases, and more than 70 countries have signed on to GHS framework. So the key objective, as I have already mentioned, is to enhance the country's capacities to prevent, detect, and respond to infectious diseases, emphasize global health security as national leader level priority, and galvanize the high level commitment to global health security, promote multi-sectoral engagement and collaboration, and focus on common and measurable targets as well. So that's that's the main I would say these are the main objectives of this global health security agenda. But the main purpose of global health security agenda is to make sure that every country has all those capacities of IHR. So global health security agenda, it also has multiple technical areas, and under those technical areas then there are sub technical areas. I'll show in the next slide. Next slide please. So what is the vision of global health security agenda? We have we learned so far that there were so many outbreaks going on, disrupting the trade and travel, and then IHR came in and support that IHR. Then US government brought global health security agenda. So we are quite obvious that the main aim of our, I would say the main vision of global health security is to make sure to enhance the global health security. So the vision of GHSA is the world that is safer and more secure from the global health threats posed by infectious disease. One where we can prevent or mitigate the impact of naturally occurring outbreaks and accidental or intentional release of dangerous pathogens. Rapidly detect and transparently report outbreaks when they occur, and employ an interconnected global network that can respond effectively to limit the spread of infectious diseases outbreak in human and animal sector, and mitigate human suffering and loss of human lives, and reduce the economic impact. So that's actually the vision that we have discussed so far. So the purpose is to make the whole world safer from these infectious diseases. So it is a shared responsibility, and definitely because as I mentioned, that the whole world is changed into a global village. So it is not a responsibility of single person, or I would say a simple country. It's a mutual responsibility. So for instance, out of 90% of the country completely followed all the all component of GHS or IHR, still there will be a threat, because the other 10% countries will not have that capacity to prevent, detect, and contain that infection. So that infection will ultimately spread to different countries. So that's how it is actually. The world has turned, and we actually need accumulative or combined efforts to fight against these infectious diseases. Next slide please. So GHS, if we see as per the index, there are different technical areas that fall under GHS. That is a prevention, detection, response, then the health system, norms, and then risk. So these are the areas, these are the sub-technical areas under global health security. So in each technical area, for instance, the prevent, there are further sub areas. So whenever GHS is being implemented, it is not just the lab diagnostic, it is not just the surveillance component, it is not just providing some supplies and working on infection prevention and control. It's not just border health, it's a cumulative comprehensive approach that also include animal sector as well, because there are so many zoonotic diseases that spread between animal to human and human to animal sector. So that whole global health security agenda, it has multiple technical areas, right? So we'll see in the next slide. And just for the record, because previously as Michelle has mentioned, that most of these talks were Pakistan based, but now we have our friends from the global offices as well, especially from African countries and Asia, etc. So I just included one component. So on the basis of these technical areas, scoring is done exactly like joint external evaluation. So right now Pakistan has 30.4 and it is on the rank of 130th country in the world. But there are so many things on on how these ranks are done, and there are so many, I would say, so many components that are actually being done in the country, but somehow it is not included in this rank. So we cannot pinpoint that okay, this is the final score, but this is the score that is right now available on Global Health Security Index website. So where we stand, and we will see it from the next slide, how these technical areas are further divided into the other areas. Next slide, please. Michelle, can you please go to the next slide?
Zainab, could you please run to the next slide? Hello.
Thank you. So, uh, as I mentioned, that each technical area is further divided into other technical areas. Under the technical area of the prevention, there are these, six further sub areas: antimicrobial resistance, zoonotic diseases, biosecurity, biosafety, dual use of research, and immunization. So, whenever we actually want to support the prevent component of our country, we should address at least most of these components. The country is able to control that AMR component. The antimicrobial stewardship is strong. The zoonotic diseases, the prevention of zoonotic diseases, the surveillance, and the reporting and containment of zoonotic diseases. These should be strengthened. Only in that way we can say, okay, this area has covered the prevent component, right? Otherwise, for instance, the reporting of zoonotic diseases is being done, but then it is not followed by the response. So reporting is being done, but response is not that there. So definitely prevention is just a dream. So that's how this global health security and all these technical areas work. Then the biosafety component, biosecurity component. So for instance, in the lab, there is, for instance, as you know, there have been multiple hypotheses going on regarding COVID-19. That and one of those hypotheses were that the virus actually came from the lab. So if it is, for instance, just for the example side, if it came, was it intentional or it was just by accident? So for that component, it is the biosecurity and the biosafety component. So biosafety, cover all the different controls of the lab system, just to assure that these microbes, whenever they are in the lab, these are in the safe hands, and it does not spread outside, or it does not affect the people working in the lab. And if it is intentionally being spreaded to different countries or different areas, then definitely there are different protocols and biosecurity as well. Then the research to make sure that the country has a stronger prevention system. And then immunization, we also know that by immunization we are able to prevent so many vaccine preventable diseases. So these are the areas that fall under the prevention component of global health security. So whenever global health security is supporting prevention component, most of the time they are supporting all these areas. But it depends in different countries, that because the support is coming to different partners, and then one partner can be supporting AMR component, and another partner can be supporting zoonotic diseases, and so on. So that's prevention. Again, the score mentioned here is of Pakistan, but definitely, and the ranks are also mentioned. If we can see the AMR, we are at 130th. Zoonotic disease is 124. But again, as I mentioned, we can still think that there are so many things going on, and the scoring can be a bit different. Next slide. Okay, the next category is detect. So in detect, detection of all those infectious diseases and all those outbreaks. So we definitely understand when it comes to detection, it's definitely it's talking about the lab component most of the time, or the surveillance component. So it includes these six sub areas: lab system strength and its quality. Is that lab able to identify the infectious agent on time with a quality, definitely. And then the supply chain of the labs. For instance, there is an outbreak going on. So are these labs, these have so much enough supplies to address all those challenges? For instance, if I can recall the CCHF outbreak in Quetta. So, for instance, we are going to conduct PCRs. So, do all the labs in that area have enough supplies to do it? or they have just a very small quantity. So that's one component, because outbreaks never, definitely outbreaks are not going to call us that okay, we are coming, so prepare yourself. So outbreaks happen, right? So the system should be there, it that all those supply chains should be maintained every time, so that if there is an outbreak, if there is a threat, we are able to address it. Then the real time surveillance is important. For instance, if there is the cases are emerging of cholera, of any infectious diseases in any area, that real time infection, that data should be reported on the provincial level, on the national level, so that the response can be maintained. So response at each and every step is solely dependent upon the detection. If we are able to detect on time with a good quality, with a real-time surveillance, that's only we can actually contain and respond. So that's another component. Surveillance data accessibility and transparency, and then case-based investigation. Once we have the detection, then case-based investigation can be there. For instance, there are environmental samples coming in of polio, for instance, in Pakistan, in any area of the Pakistan. So uh, is there any system of case-based investigation? So that's the detection. Then epidemiological workforce. There should be epidemiological workforce who can tackle these challenges. And we know that there are FETP fellows working in different provinces and different district DDSRUs and PDSRUs. And then there are definitely public health specialists as well who are working as epidemiological workforce. So that's the detect component. Next slide. Next slide, please. Can I share the screen if it is issue? Okay, you are doing it. Okay, thank you. So the next category is the response. So any infectious threat, any outbreak happen, and now we have to respond it. We have to contain it, so that it does not spread to other area, it does not spread to any other country. So under that respond component, then there is emergency preparedness and response planning. Definitely it cannot be always a firefighting, right? It's a pure technical area. So there should be a structured emergency response operation centers. There should be the HR should be there, supplies should be there, planning should be there. Okay, for instance, the COVID outbreak comes, for instance, the cholera outbreak comes. So this is the step that will be taken. So these steps will be taken. So for instance, if there is a CCHF outbreak coming, so these steps will be taken. So all these planning should be there. So whenever there is an outbreak, so that each and every step is taken as per the protocol. And then there is exercising response plans, emergency response operations, and then it also include the centers, linking public health and the security authorities, risk communication, access to communication infrastructure, trade, and travel restrictions as well. So these are different areas that fall under the response component. So whenever we are working on response component, we should work on all these technical areas. So if you can see, there is the ranking of Pakistan as well given. But I have also explained that the scores can be a bit different from the existing the ground situation, because the reporting system and all that there can be so many gray areas. um, and then there is can you go to the next slide? Okay, so the next category is the health. So in health, it is a generalized way, because whenever we are talking about any health threat, it is not just about any outbreak happening in the community. So it can be in the health system, but if even if it is in the community, all these cases have to be taken care in the health facilities. So the health is another category, and it has following of the technical areas: health capacity in the clinics and hospitals and community care centers. So whenever there is an outbreak, so does the health system is able to to address all these challenges or not? Then the next one is supply chain for the health system and healthcare workers. So supply chain of the health system is important. For instance, there is an outbreak going on. dengue outbreak, for instance, happened in the in Rawalpindi, for instance. So there are so many cases coming in the hospital, and the HR, for example, HR is not that enough to cater all those patients. So definitely we'll have to bring some HR from outside, otherwise it will affect the quality of the care. So the supply chain of the health system and the health care workers and the workforce should be adequate, and it should also have the protocols to protocols to address any urgent need. So whenever we see the Pakistan score here, or the ranking, or the score of any other country, so in each technical area there are further sub areas. uh, as I mentioned, for instance, in the supply chain of health system, it is not just about the supply chain of the one supply, for instance, of the waste management, of the medicines. It includes each and every component that is needed in the health services. And then if it is talking about the healthcare worker, it also addresses the number of the quantitative component of the healthcare workforce, the quality, their educational background, and then if there is any emergency backup plan for the workforce, if there is a need for the more workforce there, so is there any plan for that? Is there any outbreak, for instance, if there is any outbreak in a health facility, and say 30% of the workforce is affected and they are sick, so is there any plan that from where they can bring another HR to cover that? So all these areas that make the score. So it is not just one line. Under one line there are so many technical areas. Presentation is not there, Michelle.
Zainab,
So
just
when we are talking about the health, so there are so many components going on. Healthcare accessibility is important. For instance, there is an outbreak in the periphery area of the, say, for instance, Balochistan. So is there, and the people are able to have the access to the health facilities or not, and the health services. So if they don't have the access, definitely the containment and the response component will be delayed. And then that infection can spread to the other provinces, to the other countries. So the accessibility is important, and then we definitely talk about universal health coverage here as well. The other component is communications with the healthcare workers during a public health emergency. So that's another component that falls under the health. Infection control practices and availability of the equipments. Whenever there is an infection, we need a pure practices of infection control should be as per the protocols. Otherwise it is going to spread this infection to the other case. For instance, there is a case of say any infectious staph aureus outbreak is there in any health facility. So if the healthcare worker are not maintaining standard precaution, hand hygiene and other things, so definitely they will be transmitting this infection to the other patients. So from 1 to 2, 2 to 4, 4 to 8. So in this way, that infection can spread to the other cases, other people as well. And same is the example with COVID-19. For instance, there is one COVID case in a hospital, and the healthcare provider is not maintaining all those PPEs. So definitely he will get himself affected, and then he will spread this infection to the other people in the health facilities. And when these people and these healthcare workers will go in their houses, definitely they will affect their families, and from families to their neighbors to the city to the country to the another country. So that's actually the whole concept of strengthening the health system, so that the whole globe is important. So even a single component, because I know that many healthcare workers and the people who have background of health system are also here. So the purpose of each and every step that we take or that we avoid, that we ignore, it has impact on the global health. So that's all concept of global health security. And then the capacity to test and approve new medical countermeasures are also part of health system. Next slide. So the category 5, if we can see this, these are the norms. So the IHR reporting compliance. If there is any infection that can pose a threat to the global level, it should be reported on IHR platform. For instance, there is a case of Ebola in any country. There is a case of, so any disease. It can be monkeypox, it can be CCHF, any disease that can turn into a public health threat. It should be reported through IHR platform. So in each and every country, there are IHR focal points. For instance, in Pakistan, NIH, National Institute of Health, is the focal point. So whenever there is an outbreak, this outbreak should be reported timely to NIH. From NIH, then they will be reporting it to the global level. So that norm should be there, so that whenever there is a threat coming, it should be reported to other countries so that they are able to take countermeasures. So that's the norm component. So if under this component there are so many sub areas, the reporting channel from the peripheries to the national level, from national level to international level, if it is being reported in 24 hours, if it is being reported on in 48 hours. So these are the norms on the basis of which scores are being identified. So if we see, we have 50 score and 149, but there is so many debates on this scoring system because these scores are taken from the website of GHS Index. The next component is cross-border agreements on public health and animal health emergency response. So that's also important. If I can recall the recent CCHF outbreak, so it has links from those cattle that are coming cross-border to Pakistan, and then they have these animals were affected and infected, and then they actually transmitted it to the human. And from one person, it then spread it 18 healthcare workers, out of which three have been died. So people in Pakistan, they remember, they would definitely understand, because it is a recent episode that happened in Balochistan, where three healthcare workers died and 18th healthcare providers were infected and affected by CCHF. And then international commitments are also important. I can see Sige is also has joined. She is also a leader, so definitely. So the international commitment, that's another area, because it is not an isolated effort. It is not something that can be done just sitting in in one country, in one province, in one health facility. There are international commitments, all those reporting system, all those because each and every country is bound to make sure that they are not spreading an infection. So all those international commitments all fall under the norms component. And then joint external evaluation performance for veterinary service pathways. These are the assessments of the animal as well as in the human sector to identify how system is working in these health sectors. And then the financing is most important component. We are talking about prevention, we are talking about detection, we are talking about norms, but from where the funding is coming. So there are so many projects going on, international partner organizations support, international countries support, but it's up to it's definitely the sole responsibility of each and every country to have a sustainable financing. So it is not it is not a reactive way. For instance, okay, we have this outbreak, so government is issuing so many, I mean, this $1 million of funding for it. It should be it should be sustainable funding. It should be a proactive funding, so that whenever any threat comes, there is already a support, there is already a resource that can be used. So that's the financing. And definitely it is always favorable and encouraged that the financing should come from the countries, and they should make sure that this financing is sustainable as well. And definitely the next component is commitment to sharing the genetic and biological data and specimen, just to identify how infectious agent are being mutated, how the new mutations are coming, because we have to address it. It is not just in one country. If the mutation is coming, definitely that infectious agent can move to the another country, owing to all those trade and transports, right? So that's another aspect of fifth one. And then we will see 12 the sixth technical area. Next slide. That is the risk, political and security risk. We also know that if there is a political instability, all those um, uh, political rallies going on, so many issues, social unrest is there. If there is a security threat or security risk, for instance, instability is there, the war, the conflict is going on. So all these things affect the health system. So if there is a war going on, definitely the all those prevention, detection, and response, it will definitely affect. The people will not be able to access the health services. They will not be able to report it. They will not be able to have accessibility to all to those resources, including supplies, HR, finances, etc., etc. So it is another component. I think till this time all of us actually know how this whole global health security is working and what is the need of this global health security. So the next component is socio-economic resilience. That's also important, that how much the system and the country is resilient to all these socio-economic issues. So economic depression is going on in the world. So how much one country is able to, or how much they are resilient to this depression, that in a way that it does not affect their health system, it does not affect their I would say the capacity to prevent, detect, and response. So that's the resilient system. So more the resilient is the country, definitely they are more able to prevent, detect, and respond to infectious diseases. The next component is infrastructure advocacy. Definitely adequacy of infrastructure is important. It can be infrastructure of the health services, it can be infrastructure of reporting mechanism, it can be infrastructure of public health, preventive health, it can be infrastructure of all those transportation. So that's the infrastructure is most important, as we have been discussing in previous few slides. And then there is environmental risks. So if we can recall here, in the last year we witnessed a flood in Pakistan. So flood is going on in the country. So the health facilities are damaged, the cities are, the houses have been damaged, the water is stagnant, and definitely there are so many infectious diseases coming. Malaria cases are being reported, dengue is being reported, infectious diseases, skin diseases are being reported. So environmental risks also pose a threat. And definitely these infectious environmental risks also need a separate preparedness of the countries. So if there is a country that is more prone to infectious risk, then they should be prepared for it. The next component is public health vulnerability. So sorry, next slide. So GHS 2024 target, all countries, member countries committed that the next phase of GHS strategic framework term GHS 2024, it positions member countries to develop at the leadership technical areas, and it has all these areas: sustainable financing, multi-sectoral collaboration, improve information sharing, and accountability. I am just keeping an eye on the time, and I definitely know that we have only 20 minutes left, so I will just try to speed it. Next slide. Okay, so as per the GHSA target 2024, by 2021, 48 countries are meeting the targets. If you can see in the purple, and of at least five technical areas at a score of four or higher, and the 18 countries are close to target in the orange line. Meanwhile, there are within two technical areas of the meeting GHSA overreaching targets. Next slide, please. Next slide. Okay, we talked about global health security. Yeah, you can move forward. I mean, there are three lines that will come till this. Okay, stop here. So we talked about global health security. We know what global health security is all about, what are different technical areas, and but definitely IHR and global health security, it's all about infectious diseases. It's all about public health threat that can spread from one place to another place, right? So why infection control is important? It's another way of looking into it. So if we can start from the inner circle, that's and from the downside, that's a poor implementation of IPC. For instance, I'll give an example of CCHF. So one case of Crimean Congo hemorrhagic fever came in one hospital. So the hospital was unable to, follow all those infection control practices. Hand hygiene was not there, standard precautions were not there, proper protective equipments were not there. So that patient affected a doctor, and from one that doctor, that infection spread to other his colleagues, the 17 other healthcare workers, and not just only to the healthcare workers, but also to the patients. Not just the other patient, who, for instance, the one patient who was coming for some issue with his asthma, the another patient who was just coming for some skin issue, so they got infected. Once they, I mean, those patients and the doctors went back to their homes, they affected their families. So the attendant of the patient also got sick from CCHF. So that's how one infection can spread from the hospital toward, toward the community, right? So if there is a poor implementation of IPC, so it will, it will result in the spread of infection. So if we move toward the second component, that's outbreak. So it will turn that infection into an outbreak, as it happened in CCHF in Pakistan, right? So if that whole city, if that health system is unable to control that outbreak, so definitely that infection will spread outside of the country, and it may turn into health emergency of a health emergency, or public health threat of international concern, or pandemic. The same issue we have seen in the monkeypox. For instance, monkeypox is in one health facility. If it is not, I mean, that health facility is unable to contain it, it will turn into the outbreak and then to the pandemic. So it happened. We have seen that the cases of monkeypox are being reported in so many countries. So the health system is actually the center of everything, and the pure infection control practices are the base of global health security. If infection prevention and control practices are being managed and being practiced, not only in the health facility but also in the community level, definitely we can prevent and detect infections. Next slide. Next slide. Next slide, please. Yeah. So, you know, what is actual the definition of infection prevention and control program? So for that component, actually, World Health Organization brought core component of IPC. So it does not mean if a mask is being distributed or if the hand hygiene is being done. So for IPC program, each and every component should be included in it there. There should be a program, governance structure should be there, funding should be there, objective should be there. There should be guidelines. It should, everyone should know what guideline is there for this specific disease. And then training should be there for all healthcare worker, not only just the health managers but also the janitor staffs, right? Then there is HAI surveillance, the surveillance of healthcare associated infections, all those infections that that one patient acquire while he is or she is in the health services, in the health facility, and receiving health services. So all these infections should be reported so that these infections can be prevented. Multimodal strategy, it is not just okay, this outbreak is going on, so improve the hand hygiene. So there should be so many other components that are linked to it. There should be an infrastructure, there should be a teaching, there should be a monitoring component, there should be a salad component, and then there should be it all these practices of infection control should be a culture of the health facility. So there should be then the another core component is workload. If there are just two healthcare provider and hundreds of patients coming, definitely the quality will suffer. Same is with the bed occupancy and the built environment and supplies as well. So owing to the time, I'll skip few next slides, and then I'll come in toward the last part of it. Next slide, please. Next slide. Next. uh, next. 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 Keep going, I'll let you know. Next. 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 Yeah, here. So stop it. So IPC is not just what I'm saying. It's actually a global responsibility. If we see the international health regulation and under that joint external evaluation, there is a separate area of infection prevention and control. If we see the global health security agenda, it also includes one area of infection prevention and control. And then the sustainable development goal, if we see there are the problem of infectious diseases, and under universal health coverage there is quality of care and health infection control. So that's how that infection control is important. Next slide. So if we see on the joint external, next slide, we see joint external evaluation. As I mentioned, that infection prevention and control is part of joint external evaluation. It has further three sub-technical areas, exactly as we discussed in GHSA. So first one is infection prevention and control program. The second one is healthcare associated infections. All those surveillance is being done, the prevention is being done, lab is there to support. So all these things come under healthcare associated infection. The third area is safe environment. It includes the waste management, it includes the sterilization, it includes wash component, water sanitation and hygiene component. So that's all that come under joint external evaluation. And Pakistan recently conducted that joint external evaluation, and all these areas were assessed, and the recommendation for each and every area was, was compiled by MRO WHO, and then they shared it with Pakistan, the basis of which we are now developing national action plan to, to fulfill our commitment to international health regulations. Next slide. Next slide. So if we can see, uh, whichever program we are working, infection control is the core component. Maternal, newborn, and child health, if we see, IPC is there. If there is no infection control, there will be a sepsis. Neonatal sepsis, we all know, is the one of the biggest killer, and of the neonates. And these sepsis also affect, and it also increase the mortality in especially the mothers as well. Family planning and reproductive health. There are so many cancers going on that can be, that HPV we can see. Adolescent health, primary health care, immunization, nursing, safe surgeries, malaria prevention, innovations, and gender, etc. Sorry. So each technical area under health, it has one infection control component in it. The problem is that we are, infection control still is unable to have that importance. So owing to the poor IPC, that is infection prevention and control practices, each and every technical area in this health system is being affected. But the main cause is that, to have strong IPC is still somewhere, it is somehow it is not that much strengthened. It is not that much, uh, somehow it does not have that much important. But it is actually the center of all these health services. So if we have a strong IPC program, so all of these areas can be stronger as well. Next slide. Next slide. So I have just added a few slides, and I'll quickly run to it. Global Health Security Summit, happened in Pakistan last month in the December one. Sorry, January this month, January 10th to 11.
Hi,
Uh,
sorry, Dr. Zafan. I just wanted to let everybody know that, Dr. Zafan, especially that we do have like 9 minutes and we do want to leave a little bit of time for a Q&A. So maybe in another, if we can run through these maybe slightly at a faster pace, that would be
yeah,
really
yeah,
good.
just 1 minute, just maximum 1 minute. So
Yeah.
that's what we actually Pakistan came out as a commitment, just to show the commitment of the country, and we conducted this Global Health Security Summit in Pakistan. Next slide. Next slide. So there are, the people from across the world. Next slide, please. Just go on. So there are, people from across different countries. 32 countries actually came. The technical expert from WHO, UNICEF, JPIGO, different world organization came, and then there was a discussion on 5 different thematic areas. And the main discussion was what are the gaps of global health security, and what we have to do to improve and strengthen that. So that's where Pakistan government came, and we conducted that Global Health Security Summit, and in the end we developed one charter that is actually a roadmap for global health security. So that's what we have done. I'll stop here, and then we'll see if there are questions in the chat box.
Um, Thank you so much. Thank you so much, Dr. Zafan. That was a very, very enlightening presentation. Um, there, certainly, of course, did learn something new today as well. I do want to open it up to questions to everybody else too, but before I do have a couple of questions on my end. So you've mentioned, about the global health security agenda and about the different components of it, which involve like prevention, detection, preparedness. And a lot of the times, like these are, of course, like international collaborative efforts. But for countries that have, say, I don't like to use the word fragmented healthcare systems because um, sometimes, like for instance, like in the case of Pakistan, we might have a fragmented healthcare system, but again, we also performed quite well in terms of containment of COVID-19 and also avoiding like cross-border spillovers. So, how do you see Pakistan or even countries with like say similar economic or social statuses? How do you see them, if in the future? kind of working towards this global health security agenda? I know that we're ranking quite low on all these different components. How do you think we can move to a point where we might be performing better, and also what would be required? I know you've mentioned what are the specific, different components that are required to actually reach that point, but how do you see that specifically in the context of like Pakistan? Sorry, we can't hear you, Dr. Zaban.
Oh, sorry. As you mentioned, so whoever has presented this presentation, he or she can remove it now. So, as I have already, mentioned it, the scores of the country in my presentation, and we also know that the health system is fragmented, especially after our 18th Amendment. So each province has its own health system that slightly is, sometimes improved, sometimes it's weaker one. So that there are three main issues in the lower middle income countries. The first one is definitely the financing, sustainability, and I would say the commitment and the leadership. So these are the three main areas that that actually need support. So there are so many countries, especially middle income countries and lower income countries, that might not be able to have that much sustainable financing to have all these system established. So I think there is a need to that there should be a support from international organization and partner countries to come forward and make sure that whatever they are supporting, it actually is improving the health system. It is improving the system instead of just whenever we see the projects coming in different to different partner organizations, these are also segmented. It is not in a comprehensive program. So whatever is being supported to these countries, these should also be a sustainable and comprehensive program of all these prevent, detect, and respond components. uh, that's the only way first. And the second component is the commitment and leadership. That's also important. We have the funding. There are so many countries that who have enough funding, but the commitment of the country leadership is important. If the leadership is there, then definitely they can make an impact. And then the sustainability of these practices, sustainability of the finances, sustainability of the commitment as well. It is not like, for instance, one government left and then the new government is not that much interested. So yeah, so that sustainability is also important. So these are the ways these but whenever there is a change, it should come from within the system. A partner can support to some extent. They can support to 1 month, they can support to 1 year, they can support one component or the two component. It's always the country who has who should and definitely the countries should come forward and take the steps. Only in that way the countries can have a better system.
Um, yes, I think especially with the leadership point, that's of course like a very, very important one, especially in the context of Pakistan. We do have a question in the chat where
Yeah.
Dr. Shah has asked that you've mentioned the joint external evaluation, which was recently conducted in Pakistan, and are you able to highlight some of the strengths and weaknesses?
Okay, in joint external evaluation, there are 19 technical areas. And under each technical area, there are further sub-technical areas. And if one sub-technical area, there are five to say five scores, that mention the health system. But if you want to, have a cumulative response on that, one health component, the health system that actually engages the other partners as well. Animal health sector, agriculture health, climate. So there should be a system in the country that was actually weaker in the country, that whenever there's an outbreak, whenever there is an issue, it somehow we are unable to coordinate with other sectors. CCHF, for instance, I'll give once more that example. It emerged, from the animal sector, and then it affected the humans. So the coordination between human and animal, coordination between for AMR component, for instance, to the agriculture sector, to the climate sector, that was weak, and that was the one component. The second one is definitely early warning system is also one component that we have to work on. The third component was the financing and the legal framework. And the fourth one was public health emergency operations. We have public health emergency operation centers, but we need to support them with the regulations and laws, and definitely for the financing component. What we have better is that we have the I would say the radiation component in the country was the one component where we were very strong to detect if there is any threat to radiations, and we were able to contain it. And then there is the lab system is comparatively specifically the biosecurity to some extent we got a better score in that. And then surveillance system, we have integrated disease surveillance and response system in the country. So these are the few components that were to some extent stronger one, and then there are other areas that were weaker one. So joint external evaluation has a compiled report that is in the draft form so far, but that has all these gaps and strengths as well.
Thank you so much. Are there any other questions that anybody from the audience would like to ask?
Michelle, can I ask another question, please?
Yes. Sure.
So, Dr. Saban, in light of the recent COVID-19 pandemic, considering your expertise in the area, what do you think are the lessons that Pakistan has learned for preparation for any future such pandemic? Thank you.
If the commitment is there, each and every country, regardless of the resources, they can manage any pandemic or any outbreak. So that was the first lesson that I learned. The second one was, if we can work it in a reactive way, we can work it in a proactive way as well. That's another lesson that I learned, because and in those days I was working as COVID-19 lead in Islamabad, so I can see each and everything happening in the country. So we have all those centers, nerve center, NCOCs, who are managing things in across the country. So we were able to bring funding, we were able to bring HR, we were able to conduct activities in far-flung areas in the countries. So if there is a commitment, if there is we can work on, definitely every country can work and improve their health system. Just the one thing that is needed, instead of being always reactive, we just have to work proactively. We need to have that health emergency system in a sustainable way, that that health system is capable of prevent, detect, and respond to infectious diseases.
Thank you so much. So we are 1 minute over time, but I do see a hand up, so we can take one more question. If you want to unmute yourself, um, I think you can go ahead and ask, or you can put it in the chat box.
Hello. Assalamu alaikum, Dr. Subhan.
Ji, Assam.
Ji, walaikum salam, Atif. I can hear you.
Thank you, sir, for briefing presentation. Sir, as you mentioned, IPC hospital, I have multiple questions. My question is, if a patient with pregnancy high risk and delivery in labor case done a procedure, so what will be protocol if without screening her blood testing and she comes after procedure with hepatitis HIV positive? So what will be the protocol of sterilization of instrument and staff safety? And the
Okay.
second question is,
Yeah.
sir, please,
Yeah, go on.
uh, what are the protocol of fumigation in OT or hospital according to CDC or WHO protocol? And the third one is, what are the protocol of Corsilex solution for disinfection of
Okay,
instrument?
regarding second question, I think once you have asked that question to me as well in the past,
जी,
so I think I
जी,
have responded to that question.
जी.
Regarding the first question, I'll definitely need a bit more information on that. As you mentioned that there is one lady who has underwent some procedure, surgical procedure, and that lady was hepatitis what? B or C positive?
B HIV positive after procedure. We
B and
send
HIV.
जी 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 जी.
Okay, okay. Definitely, whenever we are working in the sterilization system, I think I can discuss it in, on the call with you as well. It definitely need a proper sterilization system. It depends upon which instrument are being used. Are they heat sensitive or not? If they are, heat resistant or not. So we know that there are multiple step in sterilization. So I can discuss it with you. But definitely it include, and the second component you asked about, that was also important, about the safety of the people.
जी.
Was there any prick? Was there any someone was exposed to all those infection, those blood, I would say, fluids or not. So that's another way of looking into it, because if there is no if there is no exposure to those fluids, then that the HR can, healthcare workers can just maintain their standard precautions. If there is, for instance, the patient was HIV positive, then definitely he or she needs, to go and get all those prophylaxis. There are HIV centers in different cities, and then he or she should get himself or herself tested first, and then on the basis of that, then the prophylaxis will be provided, and that prophylaxis should be received at before 72 hours almost. And then there is a 1 month protocol to use those prophylaxis, and then came back, and then you take another test of HIV. So that's the the HR component, the occupational health component. As far as the fumigation is concerned, the fumigation is not that much encouraged, I would say. There are terminal disinfections, but it will take more, all this discussion more in the pure technical aspect. But the fumigation is not, in fact, encouraged in the world. But this is a practice, some practice that is going on in the country. Over.
What, sorry, the third one, caustic solution uh, for disinfection of the instrument.
Which one?
Caustic solutions. Instruments, sir, surgical instruments.
Okay, when we talk about these chemical disinfections, uh, specifically keeping in view the practices, what's going on in the country, I have seen so many, uh, when we talk about the standards, it vary in different countries, because it's not just the use of one chemical, it's not just the use of one, way of disinfection, it's how it is being done. And especially in the countries, because if you can recall the practices of all those, for instance, in the past, there used to be one practice of the chlorine solution, where these instruments used to be submerged. So these practices, the if we see the research, if I can recall a few recent research, they show some, to some extent, promising results in the world. But the way these are being done in the country, in most of the lower middle income countries, most of the time it actually, it actually is, goes on the other way around. So it's better to avoid it, and we can see what is the resources of that health facility. You can definitely contact with me, and how much, that health facility is able to have alternate options. If, for instance, if there is no alternate option, as I think I discussed it with you in the past sometime, if there is no resource at all, then definitely these things can be done, but under definitely under different precautions.
Sir, I saw many hospital of Pakistan, especially in KP, they using caustic solution, but I think they can affect our instrument quality. So it's our weak point or strength. What do you say about this, sir?
Sorry,
It's not just about, yeah, Michelle.
sorry. I do want to interject. I do want to be respectful of everybody else's time as well. We are about 6 minutes over time.
Okay, okay, thank you. Thank you,
There
Dr.
are
Subhan. Thank you so much.
more questions. We can share Dr. Swan's email or contact if anybody else wants to get in touch as well. Um, but I did want to thank everybody for their time and for joining. And Dr. Subhan specifically, thank you so much. That was a very, very good discussion. And I think I learned a lot. I hope everybody else did too. And hopefully, we can have you back again for another detailed discussion. Um,
Thank you, Michelle, and thank you, Gallup, for this opportunity. Definitely, we are discussing. When we're discussing, we are learning as well. And for Atif, yeah, definitely, he has my contact, so he may contact me. Atif, do contact, because, as you mentioned, there are a few areas that are actually on concern on IPC and disinfection that you mentioned on KP, and definitely, I'll guide you on that. But thank you very much, Michelle, and thank you, Gallup,
thank
and
you.
thanks to all of our colleagues who have joined. From different countries. I saw a few names, because I know who have joined from different African countries, from Japago, and my colleagues as well. And it was actually a learning opportunity for me as well. Thank you.
Thank you so much. Thank you, everyone. Take care.
Thank you. Bye bye.